Brannigan, we know that the medicine, the modern medicine, allows sperm to be extracted from that person's body. Can you tell us more about that? Is there a procedure that you guys are doing?
Yeah, so for the longest time, the only way that couples could conceive would be through natural means. Um, but now, over the last 25 years, there's been technology where sperm and egg can be united in a lab dish, and this is called in vitro fertilization. And so a man's sperm can be removed from him and injected into the egg to create embryos, and those embryos could then be replaced into the female partner to achieve a pregnancy. So the interesting thing about this procedure is that the man doesn't need to be alive for this to happen. A man's sperm actually live at least 24 hours, typically, after he dies. And so what some centers are doing now is actually offering the opportunity for sperm to be removed from the testicle after the male partner has deceased. And then that sperm could be frozen and used in the future for these in vitro fertilization procedures.
What kind of procedure is this?
So in vitro fertilization involves the egg being removed from the female partner, and then the sperm is injected into the egg, and that's when fertilization occurs. And that creates an embryo, which starts out as a one cell in size, but then that cell undergoes division and can develop into a full person.
Yeah, but a deceased person, I mean, you said that the sperm continues to live.
Yes, so in most dead
Just hard to imagine.
in most dead men, the sperm will continue to live after that man has died. So it's not for a long period of time. Typically a day, sometimes several days after a man has died, the sperm remain alive.
How the sperm could be extracted?
How can they be extracted? So sperm can be extracted surgically. So it's actually a very simple procedure. So an opening is made in the scrotum with a scalpel, and then underneath the skin, the testicle is right there. And so an opening is made in the testicle, and then the doctor can access the testicular tissue, and it's inside of that testicular tissue that sperm are present. And so that tissue can be processed and frozen in a laboratory, and then it can be used even years later for this in vitro fertilization procedure.
Can you tell me more about the preservation?
Yeah, so the preservation part is, it's actually not that complicated. So briefly, the testicle is actually made up of a bunch of tiny tubules, hollow tubules, and it's inside of these tubules that sperm are produced. And so the sperm extraction procedure, this is a procedure whereby sperm are removed from the man, involves taking this tissue and in a laboratory dish teasing that tissue apart and then putting special fluid that stabilizes that tissue, putting that fluid together with the sperm and testicular tissue, and that allows that sperm to be frozen in a way that it survives freezing and thawing and can be thawed out and used. So when these sperm are thawed out after they've been frozen, they're moving, they're twitching, they're often moving forward.
Are its sperm being preserved in the hospital?
So most of the time, the sperm are preserved in what we would call a reproductive laboratory or an andrology laboratory. And sometimes these are located within hospitals. Sometimes these are located within what we call IVF or in vitro fertilization centers that are dedicated to providing reproductive medicine care.
What can you tell me about the ethical issue of extracting
Yeah,
someone?
so that's a really important question, this issue of ethical concerns. And there are a lot of interests here. So there's the interest of the person who might be requesting to have sperm harvested from her partner, from the male. there's the interest of the partner who is deceased, and then there's also the interest of the offspring, the child. And so, I think that what the American Society for Reproductive Medicine, their overall view is that, things are most clear when the male partner has written consent before he dies, saying, I would be interested in this. I would be interested in having sperm extracted and used to create a child if I die. But the fact of the matter is that most of these people that have these unexpected deaths, they don't have this consent. So there's an ethical question, would they want to father a child if they're not present to raise the child? Sometimes the answer is clear. Sometimes couples are trying to conceive and they've made that answer clear to their partner and to others. But most of the time, that specific question hasn't been answered.
So basically, this is something like a will.
So this written consent would be regarded as being, in some instances, part of that sort of end-of-life document. Yes.
What if such a consent is absent?
If such a consent is absent, then sometimes at some centers, the ethics committee or the healthcare providers will try to look closely at the situation in the deceased person's life. Did they make it clear, even though there might not have been written consent, did they make it clear to other people that they would be interested or support having their sperm removed and used to help achieve a pregnancy in the future in the event of their death?
I guess in such situations, the one who is taking the call is the person living with the deceased.
It is typically the spouse or the life partner. That is correct. Yes, that is correct. And it's interesting. So the Ethics Committee for the American Society for Reproductive Medicine has really looked at this even more closely. And so, for example, sometimes a parent, a mother, or a father may say, hey, my son died. I want you to extract his sperm. I want to use that sperm to help create a pregnancy to help him live on. And the standpoint of the American Society for Reproductive Medicine is that that situation is really not looked upon favorably and would not be looked at as being an acceptable approach. But a spouse or life partner, that's a different matter, and it's something that I think most centers would look at.
Do you have any idea how many such cases happen every year here?
Yeah, at this hospital we get maybe 2 to 3 requests a year at most. And this is a large city, the city of Chicago. And we provide care for individuals from a large area around the city. And usually it's a young man who's died in an unexpected accident. The fact of the matter is that even in instances where sperm is extracted and frozen from someone who's died, it's rarely used. It's typically recommended that the person requesting the sperm extraction, the spouse or the life partner, wait for a period of time, typically a year at most institutions, to allow for grieving and allow them to make adjustments to the death of their spouse. And after that year, what we've seen, I think nationally in the United States, is that very few individuals decide to go ahead and use sperm to procreate.
Exactly what happened in New York. There was at least a year passed before the woman got pregnant.
Yes. So, I mean, I'm familiar with that particular case and that story, and that was a couple who had been trying to achieve a pregnancy, and I think the male partner had made his interests known in advance. I don't know the specifics. I don't know if he had left a consent document or not, but I think that it was well known that he was intent on having a child with his wife.
Yeah, his whole unit was aware that they were trying to.
Yes.
Do you think that there's something missing, that we need to add something? That any unanswered question?
You know, it's interesting because, again, I think that the problem when we get these calls is that typically there's no written document and there's been no discussion by the deceased about having this procedure done. And it makes it really hard for ethics committees at hospitals because the interests and the rights of the deceased also need to be taken into account, and they're not able to voice an opinion. And so if they had made no claim that they wanted to have children, it's really hard to know if they would have wanted to have a child if they would be deceased. There are some people who would reply yes, they would want that. A lot of people who wouldn't want that. And so it makes it hard for ethics committees to really know what someone might want.
If you allow it to change the topic, there was a recent study showing that the men's sperm count is on decline. What's your comment about it?
This is an interesting issue, this issue of what's going on with men's sperm counts over time. And so there have been a number of studies, some studies over the last couple of decades suggesting that men's sperm counts are declining, and other studies that argue the opposite, that sperm counts really are remaining the same. And I think it's hard to know. I think that there's interesting data on both sides of this argument. It's interesting, the people that believe that there is a change occurring believe that things like pollution, toxins that make their way into food and water, pesticides that are rich in that have estrogen-like effects, which can hurt male fertility. They believe that these are having an impact on men. I don't know if it's true or not. I think that the data is really divided, and I don't see one study in my mind that really stands out proving that there is a decline. But I will tell you this, that every man I counsel about reproductive health, I talk to them about trying to avoid undue exposure, unwanted exposure to toxins, to chemicals, to heat. And it's something that I think there's going to be a lack of clarity on this issue for a while until a really large study is done that's done in a prospective fashion.
The study claims that using a computer a lot, especially a laptop, is potentially dangerous for the semen. Do you think that this is right?
Yeah, so it's an interesting question, and I've been able to closely look at the literature on this. And so there's a concern that men, either at work or very often at home, at the end of the day, as we often do, right? We sit down and we have our laptop, we're with our family, and maybe doing a little bit of work, right? This is what we do. And so there's concern about, does that laptop have an effect? And so there are three possible sources. One would be like the Wi-Fi, the radio signal that provides the internet access. The second would be the electromagnetic waves that just come from the electrical moving parts of the computer. And the third is the heat.
So you have Wi-Fi waves, electromagnetic waves, and heat.
And heat. Those are three sources of potential harm. And so this has been looked at in, I think, a very good fashion. And I think the takeaway from the literature at this point in time is that the one potential culprit is the heat. And so what we recommend for our patients is to just use a lap pillow if they're using their laptop, and that way there will be a buffer against the heat. But the electromagnetic waves and the Wi-Fi signal don't seem to have an effect.
No harm from them.
It does not appear to be. It's been looked at in animal models very closely in a very scientific fashion.
Last question, is there something that men should be aware about their fertility? Something that they don't often think about?
Well, I'm a strong believer in people taking care of themselves. And I think that while fertility is largely conserved, meaning you can be really sick and still be fertile, I think that what we're learning the more that we go through time is that fertility is a reflection of your overall health. And so I think really taking care of oneself is is important. And so I think, for men who are young guys, limiting the use of tobacco products, limiting the use of illicit drugs, especially marijuana, which can have large negative effects on sperm production, and avoiding excessive heat exposure. We talked about it with the computer, but it's also an issue for men who use hot tubs or steam baths.
What about sun exposure?
So sun exposure does not seem to be as closely linked to issues with fertility. It's an interesting question. There have not been links there. One other thing I would say, and I think this is so important for everyone around the world, including the Bulgarian people watching this, if you have a young man who is diagnosed with cancer, please make sure that that individual has a chance to freeze sperm before he gets his cancer treatment. It's really critically important. We see this all the time. Even today I did a procedure on a gentleman who had been given life-saving cancer treatment, and he's alive now because of his cancer treatment. But that cancer treatment has killed all of his sperm and left him infertile. And so this can all be avoided if the simple move is made to freeze sperm before the cancer treatment is initiated. So for my colleagues in Bulgaria, please be aware of this and look out for young males, any male of reproductive age who might be thinking about having children. It's critically important. And don't be afraid to speak up with the doctor and the healthcare team. If they're not offering this, they may not think about it, they may not know about it, but you should really ask about this issue. Ask about the fertility threat with cancer, cancer treatments, chemotherapy, radiation therapy, and other interventions such as surgery. Really important issue.
Thank you, Dr. Brannigan. Those were some really wise words.
Thank you very much. Thank you.
Thank you. Great.